Today we're going to introduce and show you a little bit about our AlterG anti-gravity treadmill. The anti-gravity treadmill uses differential air pressure and NASA technology to actually lift the patient up off the treadmill, reducing the compression on their joints and soft tissue. This allows a quicker return to activity and exercise, such as walking and other activities we're going to show you today, and overall accelerates a patient's rehab. To get on the AlterG, the patient puts on a pair of specially designed shorts to maintain the vacuum seal while the patient is in the treadmill. They're positioned within the cockpit, and from there, zipped into place. From there, the machine calibrates to the patient's body weight to ensure the right amount of air pressure is used. One of the nicest features of the AlterG is by altering the patient's weight-bearing status to 80% of their body weight, we get the same amount of calories burned, the same muscle activation patterns, and the same amount of cardiovascular output as if the patient was functioning on a regular treadmill. This offers a greater carryover from activities performed in the AlterG to land-based activities. Since the machine can alter a patient's weight bearing by 1% increments, we can reduce the pressure to meet the specific needs of their recovery. We can also put patients in the AlterG sideways, allowing them to perform exercises like lateral walks or lateral lunges to further challenge the hip abductors. Very often, we will start patients performing exercises like hip abduction, standing ham curls, hip extensions, bilateral heel raises, unilateral heel raises, and other unilateral exercises within the machine, with or without weights if they're unable to do these exercises due to problems with their strength, balance, or pain. Patients can also utilize the machine to work on their static or dynamic balance, as there's minimal to no fall risk as the patient's body is completely supported by air pressure. There are other aspects of the AlterG that we can use to help facilitate a quick recovery from injury. Since the AlterG also works in reverse, we can have the patient walk backwards to strengthen their gluteals and hamstrings, or on any aspect of the posterior chain. This is specifically helpful when there's injury to these areas, or for something like ACL reconstruction. We can also use the AlterG to perform squats, forward or backward lunges, or any other weight-bearing exercises within the machine if it's too painful or too early on in a patient's recovery to perform them on land. We just watched Tyler doing some squats with reduced weight bearing. Now he's doing forward lunges to strengthen his quads, glutes, and hamstrings with reduced compression to his knees. The uses for the AlterG are only limited by the imagination, and there are a huge amount of diagnoses that can benefit. Orthopedic injuries or conditions such as arthritis, stress fractures, tendinitis or tendinosis, bursitis, degenerative discs, radiculopathy or sciatica, and many others can all be more successfully managed using the AlterG and enabling the patient to recover more quickly. Patients with neurological problems such as stroke, multiple sclerosis, gait and balance problems, just to name a few, can exercise more safely, building muscle to help improve their function with less risk of falls or injury.